Last but not least for the night, we have Ms. O'Connor with us to talk to us about the Health Careers Program. And I think she's here. Ms. O'Connor?
I am here. Hello, hello. How are
Hi,
you?
hi, hi. I'm well. How are you?
I've just been excited. I was watching some of my friends do their speeches and I was, wow. I went to their program too. They really are amazing. And the classes are amazing. That's what's great about it. Just working next to these people. It's so wonderful. So
Yeah,
many things they learn. It's so exciting. So I'm going to share my screen. I hope I'm doing. There we go. Got it right. Only because I want to stay on track of what I'm teaching you. So I hope
sure.
it worked. Did it go up for me?
Let's see. I
Let
still
me
see
see.
you.
Share content. There we go. I feel like it didn't share.
I
Is it
think
going
it's
to
going.
work? Oh, did it share for you? Because it's not showing on mine.
No, I still have you and that beautiful piece,
Yeah.
the beautiful quilt.
Isn't it great? It's butterflies. It's my hobby. I quilt.
Oh, really?
Yes, I do.
I
You
not to get
knit.
too off track, but I
Oh,
knit and
I see. I was
we
going
had
to
an
write
office
you.
competition of for Christmas, and I did an ugly Christmas sweater theme, and there's just yarn everywhere.
Oh, and I was going to
Everywhere.
write you a message. I was going to send you a message, but you were busy asking you what is floating all over your room with the yarn. So, well, anyway, welcome everybody. I'm so happy to meet all of you. I'm happy you could come tonight to talk about health careers and basic nursing skills. And our program's been around a bit, but we're going to talk about the highlights of our program. And I'll try and get through these. And if you have a question, just interrupt me, and I'll pause because I can talk for 2.5 hours. Ask my kids. So one of the main things we do in our junior year, especially, is we make sure that our juniors get to know the variety there is in healthcare. Our program, Health Careers and Basic Nursing, really prepares students for any aspect of healthcare. And now we have an EMT area, but we also did encourage that was another opportunity, and you could slide right into that program from our program. So we usually get nurses, doctors, physician assistants, nurse practitioners, physical therapists, occupational therapists, respiratory therapists, dietitians, and the colleges to come in and talk to you about what's available and what opportunities are there. So our graduates, where they are today, it's so exciting. I just went to a graduation virtual, of course, and it was wonderful because this particular girl came out of my program and she graduated in June. She went to school the following October with a Grade 1 BOCES LPN program, and she is now a licensed practical nurse, and she was out of school for 1 year and she's already
Wow.
a nurse. So that's amazing. Now, there's our LPN program that we do offer in our workforce development, which is wonderful because you can slide right into it. We cover an awful lot of what they learn in the first, almost the first part of their program, because our program was written around the LPN program. Many moons ago, you used to be able to take an LPN program in high school, and the state put a kibosh on that. They said no, because nursing has become so intense academically, and you needed to have that level. They didn't feel students at a minor age could handle what they needed to deal with. So we developed this program to get you ready for nursing, because if you've heard anything about nursing programs, and you can't not hear it if you're interested in nursing, is it's a really tough program in college. There is a very high fail rate, sadly, because people walk in not knowing what to expect and are not prepared for it. And I'm proud to say our program prepares you for what you're going to see. And we give you a lot of reality in there, a lot of preparation. So when you get into your college, that first year of nursing, you're going to say, oh, wow, I learned this already. Or, wow, I got this. And it's going to help you deal with some of the stressors that happen in a nursing program. So my other graduates, the 4-year degree nurses that have finished up. So I've been doing this job for 6 years. And so I'm just starting to see those 4-year graduates. Oftentimes when you hear the word 4-year degree, it's not exactly 4 years. Sometimes you can't get the class you need to finish, or you might goof up on a class because you're not quite mature enough to really to give it 100%, which they get yelled at by me because they write me. They keep in contact often, and I remind them what I taught them. So that being said, I have just had 2 bachelor's degree graduates come out of Deauville and Damon recently. And these are not all the kids, but some of the main features, I guess, the ones that have been keeping up and talking. Others have worked as CNAs. I have one of my students that came out of school a couple years ago, really isn't ready for college, mostly for financial reasons. Started working he got a CNA right out of our program. He worked at actually where we went for clinical at Macaulay Residence, and he just went and got a job at Roswell in the ICU. And he is
Wow.
absolutely loving it. And he tends to come and visit us when he can. Pre-COVID, he comes often and visits us, and we get to see how he's doing. He comes and helps the kids with skills and preps them for the CNA. So that's some of that. We start with talking about therapeutic communication, because in order to work in healthcare, you've got to be able to communicate with people and know how to deal and know the right way to say things and how to and not take things. So we deal with cultural diversity and proper speaking. We teach about the law because we do go out into the clinical area and we have to know what the rules and regulations are to get there. Our seniors do clinical. Our juniors learn and we practice and get ready, and our seniors go to clinical. Our juniors have a lot of fun. I'm getting them ready now, those real babies. And I could have brought one in here because they're actually home.
Man, I remember the real baby.
Yes. So they're fun. So we have the real baby, and the real babies, they take them it's a 48-hour time. We set them up and they turn on in the Friday afternoon after school, and they turn off Sunday. And it's a really wonderful awakening about what childcare is like. And parents really love it. Kids love them. They're real cute. They smell like babies. They're really cute. But usually after 2 nights of having to get up and feed a baby at night, they're happy to see me pick them up.
I distinctly remember my project for health class was on a long weekend.
Yes, isn't that great?
An extra day of the baby.
So that's a lot of fun, right? They are so cute though, and they do love them. And I still have seniors wanting to take them again. So some people love it. Some people are like, take this thing out of here. But it's a really good experience. And I think the parents especially loved it. The parents felt like, wow, this is awesome. This is what I need for my daughter. I want her to realize, or my son, I want him to realize what it takes to do this parenting thing. Medical terminology we spend a lot of time on. We start in the junior year and we repeat everything in the senior year when it comes to medical terminology. As a side note, with our program, you can come in as a junior or a senior, which is super awesome because a lot of times students are forced to take things at their home school, maybe in their junior year, and they can't fit our program into their schedule. But they don't have to give up on us because our nursing program allows you to come in for 1 year, still get your CNA. It's a little bit tougher in the sense that everything will be the first time for you, and the juniors that have passed through already have seen it once. And not to say that it's just a rerun. It really isn't, because we go into more detail in the senior year, but we just review what we learned in the junior year kind of quickly, and then we go on to the deeper things in the senior year. So it is an opportunity. You do have to really work at it if you're going to come in as 1 year, but it is very possible. One of my top students last year was one of those students that came in as a senior because she didn't even know about the program until mid-junior year. So it is an option. Anatomy, where'd that come from? And physiology is obviously our biggest topic. And we work so hard with this. Just students, you've got to understand your body. And you've got to understand how it works, or you can't understand when it's broken what's happening. So we really focus on this. We go through every body system. We do projects. We do demonstrations. Students have to give presentations. In the junior year, we have the juniors actually work as a team, and they not only have to do a slide presentation together as a team, but they have to give a demonstration demonstrating how the body works. And I'm always amazed at the technology and the creativity the students come up with. We had students once had everybody hold hands, and they had the students going in and out in a big circle and crawling under each other to show the way oxygen moves. And it was amazing because it made sense when they did it. And who would have thought of this? They always have wonderful ideas. So I really enjoy the creativity. Of course, they got a great grade because it was amazing.
I know that this is like not a night nursing class, but I'm trying to figure out how that shape would be how oxygen moves. I mean, that's a
I
different
know.
talk for a different day, right? But
Yes, it was really cool. They just slid it. They showed inhalation, exhalation, and they showed it slipping, and they crossed, and they had a step over. It was amazing. This girl that designed it, I was like, wow, that was really creative. And
wow.
I don't know, but again, great ideas, showing the lung work, showing how a heart pumps. They just are amazing, the things they've done. Yes, students have come in and shown how to put a condom on for the
Hey,
reproductive system, but again, they really still had to come up with that teaching. And healthcare is all about teaching, and that is so important because what you know isn't just for you. When you're a healthcare provider, you have to share it with the community that you service.
right.
Because if you can't teach the people what to do every day to care for themselves, then you're of no use. You're going to handle a million emergencies, but no one's really going to get better because you didn't teach them how to keep themselves healthy. So really
Right.
important. So great job. We work on CAMs, which are complementary alternative medicine. And CAMs are so important. Well, first of all, I love CAMs because my master's degree is in CAMs. I absolutely love holistic care. And so that being said, you do see a lot more of it with me. But the reason we push it is because everyone's doing it now. Everyone's into it. It works. It's helpful. With the nuance of COVID, we see so many relaxation techniques, meditations, breathing exercises, and these are all CAMs. And so what's really nice is all of my students have that toolbox, a toolbox of things to help them feel better and deal with their stress. And the reason that I pushed the CAM so much in high school is because my background is 30 plus years in emergency medicine. And a lot of what I saw were a lot of teenagers come college exam time, a lot of
Yeah.
panic attacks, anxiety, seeing so many young people on medications for anxiety. And sometimes there's another way. Not always, but sometimes. And so teaching them all these tools they can have in their toolbox for when they have a rough day or when things are stressful has really made a difference for them. So we've taught things like color therapy, music therapy, and they really enjoy doing the activities and they've learned from it. And then they research and they have to write on, after they've done that study, what works for them and how does it make you feel? And
Hmm.
what would you share with others? So it's really nice, and they do enjoy it. We've done things like aromatherapy, just trying all different camps.
Yeah, and those methods are really attainable for high schoolers too.
Yes, exactly. Also, with people that do not have any health insurance, we don't recommend people not see their doctors, but oftentimes we can calm people down, and so their symptoms are more tolerable till they can get to a doctor. And unfortunately, we do have a lot of healthcare issues in in our society with people
Yeah.
without insurance. So again, EMT talked an awful lot about first aid. We
Yeah.
also do first aid. We spend about a month on first aid in the junior year, and then we incorporate that into our clinical setting and into our, clinical area and scenarios and things all through the senior year. And our students do get their certification for CPR, their healthcare BLS card, and they get the healthcare level though, and that's very important. And I'm sure that the EMT also does. But the difference is you can go get a BLS card somewhere and take CPR and get your first aid certification, but you need to get the healthcare level. Healthcare level teaches you how to use things like ambu bags, how to do defibrillation, things like that. And so we need to have these added pieces on if we're going to be in a healthcare field. And so that's something we offer. Our seniors get that at the end of the senior year, the actual certification card. And it's really nice because it only costs them the cost of the Heart Association charges our school, which is about $4 for the printing of the card. And we
Oh,
all know to take a course, it would be a lot more money. So our requirements really in the junior year, it's like come to class, do your best.
hmm.
I teach people, the course is not a cakewalk. I can remember back in the day, because like I said, I've been around a longer time, and I can remember that BOCES said, "Oh, that was a place you went when you didn't want to go to school." This is not that class. This class is academically heavy, but you have to know this stuff. You have to know the technology of healthcare. You have to know the anatomy, the physiology. You have to do mathematics. You have to do calculations of medications. So you have to understand that you have to do conversions for weights and things. So as we talked with Ms. Wright about the kilograms and conversions, healthcare works in kilograms. So we have to convert everybody's pounds into kilograms, and they have to be accurate. If not, you can kill someone. So it's a big deal. So when we get ready for our senior year, we come in, we're getting prepared for clinical. So there are a set of skills they have to learn. They have to get a full physical from their doctor for the senior year only. And that includes the immunizations. And I'm not even going to begin to tell you the list because it could change with our COVID.
Sure.
We don't know. I couldn't tell you, and the state doesn't know yet, but I wouldn't be surprised if a COVID immunization would be on there. A PPD is something added, and a PPD is for tuberculosis, and that is required to walk into any healthcare facility as a student or a worker. You have to have that. And so that's a skin test where they check you for tuberculosis. So that's something that normally that has to be done for our clinical. For the seniors in the Kenton where I teach, we use blue pants, white shirt. We use the white shoes, and the shoes have to be completely covering your foot. No little sandals, no Crocs with the back off. They have to be on. And a watch with a second hand. So no Apple watches, no digital watches. Watch, good old-fashioned analog watch with a second hand because you will be taking vital signs. And you have to use that. We don't bring phones to clinical as they are forbidden in a clinical setting. And they're forbidden because of patients' pride. Learn about legal and ethical. Our dress code is all equivalent to every nursing program. You can look online to any nursing program and we'll have the same rules. So we have rules. We have to have our hair tied back. We can only wear very small earrings that don't dangle. We can't wear any jewelry except a wedding band, and I've not had a student married yet. So we don't have to worry about that. You can wear your watch. You cannot wear additional earrings. You can't have nose rings, no facial piercings. They're all risks of infection, and we're not allowed to have those. And it's interesting this year because we don't know if we're getting to clinical because of COVID. We understand that. And because we are minors, it's even more difficult with the situation. But this year we're even wearing a mask, and I had to tease my students that, yes, I know that you have a mask on, but you still can't wear a nose ring because I know it's there. Right. So we have to make sure we're safe. These are the things going on right now. And again, everyone always asks, what do we need for the junior year? You really need to show up, do your very best, and decide if this is for you. And what I love mostly about the program is the people that finish that love it will continue on and be amazing healthcare providers. And the people that decide it's not for them have saved their parents thousands of dollars in college classes to find out that it's not for them.
And I can attest to that. Yep.
And so nursing is very specific because we really care for people. And I tell my students it's the most gratifying job there is because where else can you be so very personal with a stranger and make such an amazing difference on such a deep level?
Right.
Where else does a stranger just allow you to be so close to them and touch them in ways that only your family and your personal family would be doing? And they're your stranger, and you can make this difference, and you're involved in some of their most important parts of their day. You know, when someone's going through a crisis, you're the person there, and they've allowed you in that moment, and it's just a feeling that you can never ever lose.
Yeah, well, and a lot of your patients are vulnerable, right? That's a huge thing to let people in when you're in a vulnerable state.
Yes, so it's wonderful, and that is the piece. And some of the students will say, oh, this isn't for me. I don't want to be and touch people and stuff. And it's, thank goodness they find out when they're in my clinical before their parents or themselves get those big student loans for $15,000 to go sign up for a nursing program and find out it's not for them. So I'm really happy that we can offer this to students. And I certainly want everybody to be in healthcare because I love it. But I also realize not everybody turns that. I had a girl one year loved healthcare, but she developed an illness herself that made her very vulnerable to illness because she had a disease that she had to take steroids, which would lower her immune system. And her doctor said, this is the worst place you can consider being. Yeah. And she totally had to change, but she took her communication that she learned, and that's her practice, and she does communication. And that was her degree now working at Niagara University. And it's amazing that it still helped her. She still raves about all she learned about that professionalism and the communication. So it still was worth it to her.
Absolutely.
I don't know if any of the schools talked about or any of the groups talked, but we do some things across the board in BOCES, and they're on my PowerPoint because I use this for open house, and I wanted to share. Portfolio is something, this ELA business, English Language Arts, how we demonstrate that you are working the standards that you need for your degree, for the credits you're receiving from us. And so this is important. So we do have a portfolio. I have to tell you, my portfolio has been rated as a very best portfolio because it is so awesome. I want to tell you, I've heard that from other people. I'm so proud.
I
And
love
it's
that. You should
because
be proud. I
I'm
love
very
that.
proud because the students do the amazing work. This year, we're actually doing virtual portfolios, and they're beautiful. They're using Google
Awesome.
Sites that looks like a website where they're putting all their work. Beautiful work, all related to healthcare, and not just a lot of research papers, a lot of fun too. Like the mind body, they had to do some choices on some meditation or therapy, color therapy, and then they had to demonstrate and tell how it worked and what they thought of it. So it's not just a bunch of writing. They have wonderful times. They've had to do a video on doing a skill and put it on their site. So it's really fun. So they really do a great job. The skills, there are over 20 skills that we work on. We work on some basic skills in the junior year, and we do continue to add skills on every year. So they're learning things such as using what's called a gait belt to move people, how to bathe someone, how to lift someone, how to position someone. They learn taking temperature, pulse, respiration, blood pressure, but not just the here's how you do it, but why and what does it mean? And I always think that's the biggest deal. If we understand why we're doing things and what it means, that's the essence of the point of everything. You'll always know what to do if you understand why you're doing the things you do. So we go as far as teaching bedpan use, bathing someone, doing oral care on someone, feeding someone, because these are the things we're going to go to clinical. Our students will go on to clinical. And so here's some students with some skills. They look
Fun.
so
Very
hip.
fun. So that's your classroom.
This is a one of the picture classroom. There are two classrooms at Kenton, there's two extra classrooms and then an actual lab at Harkness. And at Potter, there's one teacher in a classroom, and then they have a separate clinical area. Harkness is, or rather, Kenton's a little bit different because we have one very large classroom that half of it is a lab, and then we have a small classroom that we are presently using it with a lab in it. Then we had to take some of the classroom away because of COVID. And so again, we're sharing, we make it work. And again, we have hybrid right now, so we have less students. They will be opening that up and making two giant classrooms, which I love because we do have a lot of academics in our class, and I like to be able to do academics and then stop and do some skill time. And if we have to bounce to different rooms, it might not be as easy. So having the clinical right in our room is really helpful for our group.
Yeah, absolutely.
Here's my one of my students. He's the one that works as an orderly, and role playing is part of, well, we prepare to take care of people. And this is Blake. Blake was pretending he was elderly. He wanted to put that wig on. But it was fun because we practiced then how to walk them, what a proper shoes, how to use the gait belt properly. And because our students understand that our clients are not always going to be, oh, sure, no problem, he would play up that act and how will the students deal with that. So that was really a nice thing to do. And we
That's
do
awesome.
those activities all the time. I've had students lay in bed during class and say you weren't allowed to move. If you needed something, you had to ring the bell, and one of your providers would come over and take care of you. And so it was nice because if they even wanted to drink from their water bottle before COVID, when we didn't have masks on,
Right.
the student would have to go over, wash their hands, get the drink for them, hold it for them, and then put it down in the bedside stand. If they wanted to go to the bathroom, they had to wheel them into the ladies' room. So it was a really good thing. I shouldn't just say ladies' room because I do have men in my class too.
Sure.
I have, fortunately, this year I'm excited. There are actually 4 boys in the junior class of a class of 20. I think that's great.
Yeah,
Because
absolutely.
we really want to see men in healthcare. It's a great thing, and they do a great job, and they're all very passionate. One of our trips is to Mercy Flight. Made me think of when you were talking to our EMT teacher, because Mercy Flight is somewhere where medics also work. So there's a flight nurse, the paramedic that flies, the EMT, and the pilot. and they're the people that respond. And we've been actually able to be so fortunate. We've gone out to our field trip where they show us everything they've got there, and they've actually been called out on a call during our visit.
Oh,
And
wow.
we were able to not only see the inside of the Mercy flight and look and actually climb into the helicopter, but that day we were able to watch the flight get ready. Our person that was touring us had to get on the helicopter, and they took off, and we got to see them take off. So it's pretty amazing the opportunities that we had just popping in for a visit.
Yeah, that's really cool.
Isn't it? This Buffalo Science Museum, we go there, and this is something I like to do for my seniors. We like to go out for the end of the year kind of a fun graduation thing. We spend the day there, we pack lunches, and they do a dissection. And dissection and lunch doesn't bother us because we're healthcare people. We just have a really good time, and they get to really make friends. And I guess this is where I want to talk just a minute about the difference of coming into BOCES over being in your home school. We've all gone, some of the schools are bigger than others, but we get in a point where these are the same kids we've seen. If we stayed in the same school, stayed in the same house we grew up in, we grow up and we're in the same town and we meet everybody, we know everybody in the school, and that's it. And then we go to college and we kind of have a culture shock because there's all these people and you might not know anybody.
Yeah.
BOCES does a couple of things. It gets you used to that culture shock because you come in and have perhaps 6 different schools coming into one facility. So you're going to meet students from all different areas, which is amazing to see. And then you're going to go off to these colleges if you choose these healthcare careers, like nursing, PA school things. And I wanted to mention, I do have several people in PA school. They just aren't done yet because it
Right.
takes a little longer, and they had to get in first, so they took a year of putting time in at work because there's a prerequisite involved, but they did a great job, and they're now doing great. Just made me think of that. Sorry, but
Oh, that's fine.
I love these students. They get out and they're telling me, "Oh, Mrs. O'Connor, so and so from the other nursing classes in there because we got together, and it was so nice to have somebody there, but besides strangers." Or
Right.
hoping somebody from your high school class is in the same program as you. Because they all have the same goals to be in healthcare, we see a lot more students are finding a friendly face when they go to these
Yes.
universities. So it's a big deal. And I love that they make friends because, back in the day, used to have the Kenmore East-West flights, the Tonawanda, North Tonawanda flights, and now they come together and you've got kids from Kenmore, Grand Island, and they tell me they're baking cookies together on the holidays or something because they've made these new friends.
Right.
It's a nice place for kids to get that second chance. Sometimes we get the stigma in the same whatever we are, whether we're the smart kid or whatever, and maybe certain kids don't like us or aren't kind to us, and we come into BOCES and we have this whole new start of a new friendships, a new life. So
Yep.
that's another exciting piece, and that's BOCES across the board. So Gross Anatomy Lab is by far the highest, most wonderful place kids want to go. It's at the University of Buffalo. They go into the Gross Anatomy Lab and they actually handle cadavers. They handle the body parts in their hands. And again, I'm going to brag about my class because I go in there and I have heard Mr. Wyke, who's in charge of the program, say, "You are the most full, knowledgeable class I've ever had."
Look at
And
that.
I love it. These kids are smart, they know stuff, and he's impressed, and he's a college doctor. So pretty impressive. We look at the clinical observation. Our clinical observation briefly is we go 13 visits to Macaulay from Kenton, and we go 6 visits roughly to Kenmore Mercy to observe. We also do field trips. We've gone to Excelsior Orthopedics, seen this Buffalo Surge there. We also have done trips out to ECMC and toured there. So lots of variety. Internships are at the end of our senior year. It's a 2-week area that could be different this year, but we have that 2-week internship. Students choose any kind of healthcare facility. They're interested, they seek out these opportunities, and we work to set them up, and they spend 20 hours there just observing. I've had students go into surgery. One girl just asked her dad's doctor, he just had surgery, if she could intern with them, and he let her prep every day and go into the OR as he did orthopedic surgery. He had other people, chiropractors go in, massage therapists, pain management doctors. We've had people work in the nurseries, at children's, at sisters, and on med surge floors, cardiac floors. So we've had a lot of variety that the students had opportunities to see, and these were all their choices. And some also did like medicine in places like factories, because
Really?
we have nurses there, and so they deal with. We've had nurse physician assistants that work there, and we've had our students go there and observe the day of taking care of people working in factories. So
Wow.
another opportunity. School nurses, another opportunity. Skills US Day is something in all of BOCES offered. It is a wonderful national organization. It looks wonderful on your resume, and they go and do competitions across the state. For the healthcare, it's usually the Health Bowl, where it's health information and health terminology, and they compete against other schools. They do very well with that. I believe Potter won. Well, I'm going to say it was the year before last, because last year was messed up with COVID.
Right.
So they do really well. Honor Society is another opportunity in our system, and that is any student can be nominated that has a 90 or better in our program and has an 85 or better in their home school and has only missed 13 or less days in 5 quarters, so all of their junior year and the first semester of their senior year. And it is the most beautiful ceremony, and I'm so proud. And my students, I see them already, they're up there, and every year we get to go and just enjoy an amazing ceremony of these now. Of course, again, COVID, let's drop that one, but it is
Right.
going to get better. We're going to get better, guys. We're going to go back to everything awesome. New Visions is not a program I'm going to talk about, but is another high school opportunity for the seniors. And this is a special program that you have to be interviewed and chosen for. And so the very top people that go in their interview, and it's not just your grades. You
Right.
actually have to interview well. You have to be a very good speaker and really get yourself in. And this program, their actual classroom is at the hospital. And I believe we're almost out of time. I'm sorry. Finish up. BLS I talked about. You get that care provider card. CNA certification is something you can choose to have, and that is we work for that in our senior year, and then at the end, we go into July for a week of 40-hour work week. You test with the state, and you can be a certified nursing assistant. And that's the requirements for the CNA. It's about $115 to take, but that's a state fee. And there are some specifics we can go through. And these are the articulation agreements that we have with the different colleges to carry on. So Bryan and Stratton. And these are all available on our website, so you don't need to memorize them now. And Irwin BOCES Adult Education, SUNY Canton, SUNY Erie Community College. And
That's quite a few credits.
Yes, wasn't it?
Yeah.
And so that is my informational. I don't know if there's any questions I ignored. I know our program has a lot of stuff to offer. And I talked over our time, and I apologize for talking over.
No, this is fantastic information. I mean, I know I had a list of questions, but you literally answered every single one of them. So,
I thought I might.
yeah. So if anyone has any questions, feel free to either type them in the chat or go ahead and unmute yourself in the interest of time. But otherwise, I mean, learning so much. Every single time I see a presentation, I'm like, oh, I want to take that class. No, I want to take that class. No, I want to take that class. But time's not on my side with that one. So I can't go backwards. But I did think it was really neat that you could tie a lot of what you said into the other programs with the teachers that you teach with. And it just goes to show, again, I'm going to say, I keep repeating myself, but even if you don't go into the medical field, even if you don't want to be a nurse, these are life skills that it'll never be a bad thing to know CPR or to know, I think Mr. Turner said, blood compression or
Controlling a
stop
bleeding.
bleeding. Yeah.
Yeah.
So these are things that are valuable regardless of what you end up doing.
Well, you want to be intelligent when you speak to doctors. You're always going to have your body. We hope you're going to be healthy. But when you do get into a situation where you have to deal with the medical field, knowledge is good. You know, knowledge
Right.
is good and understanding. I remember one of my students early in her junior year, she had her grandma was sick and they went down to Florida to see grandma and there were some notes written out. And she told the doctor she's taking a medical class and he let her see the notes. And here she is, a 16-year-old, and she could read everything he wrote, all his medical terms. She knew them, she understood them, and it was early in the year. And she
That's
came back
awesome.
so proud. And so, why would knowledge of healthcare? I guess my main goal is if you want to be in healthcare, awesome, then this is the place for you. Some people take those advanced Regents courses, which are also wonderful, except sometimes they interfere with when we have class. And I would tell you, they're great, but make sure wherever you're going to college is going to accept the Regents credit before you choose them over me,
Yeah.
because my knowledge is going to help you in a healthcare field, and the Regents is going to give you credit on that Regents if the school takes it. So just please know, make a choice on that before you decision. Um, our program is always very big. We have, like I said, most classes are one class in the school. Nursing has two at Kenton, two at Harkness, and right now one at Potter, but they have had two at Potter also.
Yeah.
So we have an awful lot of nursing programs because it is a big program where we usually have a lot of people in it.
Yeah, it's very
And I
popular.
guess that's all I have to say. Any questions? Or you can email me too, because I know it's getting late. And I'm on the website, joconnor@e1b.org, under the healthcare teachers.
We have
And
two
so,
quick we have
oh,
two questions if we
great.
can answer them quick. Let's see. Would this be hang on, there's one. It seems heavy for nursing. If a student is interested in PT, would this be a good program?
Absolutely. And also, I see this radiology program too.
Yep.
I have had students for both, and I have some right now. Actually, I also have one that wants to be a dental hygienist. Now, her I would have referred to our dental hygienist program, but she didn't decide that till now. So, physical therapy and radiology, they all have the same prerequisites in nursing. They have the anatomy, the physiology, we cover that. They have to have the medical terminology, they take that. These are all the things we're teaching. We also are teaching positioning. Well, radiology does a lot of positioning. We're teaching mathematics related to healthcare. Radiology is full of math, and physical therapy is full of math. Actually, one of the speakers we come in all the time, I happen to have a daughter-in-law who's a PTA, so it's a physical therapy assistant. She comes in and talks, and Niagara Community comes in often and talks about their programs, and they have the radiology tech. I have students that have become echo techs after radiology technician, the first, and so they come and talk. But there isn't a medical field out there that doesn't need what I teach. The
Right.
second year is definitely nursing in the sense that we can have the CNA and you're going to go perform nursing assistant duties. That's true. But you need to do hands-on in every field you're going in, and you have to have that. Another point is many of these programs, physical therapy and physician assistants, they want you to have 95 hours of bedside care that you've done before they'll take you in their program. So you might need to get your CNA, or you might need to work as a home health aide. So places like People's Inc., they hire our students immediately when they hear they came to our program because they know that we teach them the proper care of patients. They'll still put you through a short training, but they know you're going to do well because you already know what it's like to take care of someone. So I absolutely tell you that it's wonderful. And students, even in radiology, they're going to do personal things. They're going to do barium enemas, where they're going to be putting enemas in on a person laying on a table. And they're going to have to do these types of treatments. So they have to be prepared for that hands-on touching bodies of other people. It's not just broken bones that we take care of in radiology. And physical therapy too, working with people coming from an outpatient versus inside a hospital where people have lots of tubes and wounds and things that they've got to touch and they're not in their street clothes. So we have to get used to touching those bodies. And so our program allows you that chance to get used to that.
Yeah. There is one other question. Is this program good if you want to major in psychology and minor in nursing?
Well, I don't know about minoring in nursing. I understand. Are you thinking? I guess I'd want to ask you, and you could email me for specifics on your personal thing. Are you looking to work as a nurse and then work in psychology or psychiatry type nursing? If so, you have to be a nurse first. If you're looking to be a counselor, you wouldn't be a nurse too, unless you want to have two jobs. I'm not really sure. So if you could maybe write me, it's here, I can type it in there, can I? what's it going to work? Here, let me get the chat really fast, but I'm online. So if you can't find me, if you send me an email, I can write you information back on your personal question. Did it come in there?
There it is.
Did my chat show up? I don't know if it did. I thought I put it in.
JO'Connor@e1b.org.
And you can write me with those questions. I did put it in twice, but I don't know if it's showing up because on my end it doesn't show. Is my email coming up? Good.
Yep, it's there.
It just was a delay. Okay.
Yeah.
But yes, absolutely. Feel free to write me. I don't mind answering your questions, but I'm not quite sure what you mean by that. So I'd like to hear from you a little more detail.
Perfect. I think that's all our questions. Ms. O'Connor, thank you so much for sharing so much knowledge with us.
Yes. Write me a note on what you want me to close down so I'm not too late the next time. I'm sorry to take up your time.
No, you're fine. It's nice because you're the last one tonight.
Yes,
Next week,
I know.
not so much.
I know you'll have to shut me down.
That's
Thank you so much. Thanks everybody for coming. I hope that you answered your questions and feel free to write if you have further ones. Have a great day.
Oh, thank you so much. All right, that wraps us up tonight. We have 2 more tomorrow and Thursday, and then all again next week. So feel free to tune back in if you have more questions. But other than that, thanks everybody for spending your time with us.
Thank you.
Thank you.
Nope.
And I will say this, people interested in nursing and our nursing students are the most polite students on the face of the planet.